Choosing to undergo bariatric surgery is a massive life decision. Deciding to fly to a different country for that procedure introduces a heavy layer of logistical and clinical stress. There is an inherent risk in stepping onto a plane to enter an unfamiliar operating room. Dr. Luis Mez's practice in Mérida, Mexico, mitigates that risk by replacing the typical medical tourism package with a strictly controlled clinical protocol. This protocol builds safety into the process weeks before the flight, beginning the clinical evaluation while you are still at home in your own country. This rigid roadmap of medical clearances, dietary changes, and travel buffers manages the variables of the journey, turning a complex international trip into a securely managed medical event. Before any travel is booked, candidates must meet specific clinical thresholds. This means a body mass index of 35 or higher, or a BMI over 30 if accompanied by metabolic conditions like type 2 diabetes. Crucially, the patient must be ready to commit to a lifelong change in their diet and lifestyle. This chart lists the required preoperative hematology and biochemistry screenings that must be completed at your point of origin, specifically in Canada, before you are cleared to fly. The surgical team needs to verify your hemoglobin levels, kidney function, and blood sugar control well in advance. Looking at the bottom section of this document, we see the priority criteria for delaying or canceling a procedure. If a patient presents with a severe uncorrected anemia, uncontrolled diabetes, or an active infection, they are preemptively disqualified from traveling. While the core blood work is strictly required in Canada, there is flexibility for secondary tests. As indicated by the Origin or Mérida designations, procedures like abdominal ultrasounds or endoscopies can be finalized upon arrival in Mexico if they couldn't be scheduled at home. Front-loading this medical vetting process ensures you are physically fit for anesthesia before you spend money on flights or take time off work. It eliminates the worst-case scenario of arriving abroad only to find out you cannot be operated on. As the surgery date approaches, specific medications must be paused. GLP-1 analogs like semaglutide are stopped a week prior to prevent aspiration risks, and SGLT2 inhibitors are paused to eliminate the risk of ketoacidosis. The protocol dictates a mandatory 10-night minimum stay in Mérida, 1 to 3 nights in the hospital, and the rest at a nearby hotel. This keeps the patient close during the highest risk window. By day 10, complication risks drop, making flying safe. This timeline also includes a preoperative phase. Patients must strictly follow a very low-calorie liver reduction diet for 1 to 2 weeks before their arrival. Shrinking the liver provides the surgeon with clear, safe access to the stomach. The extended stay and the strict diet require a time commitment. They serve as a non-negotiable medical safety buffer, protecting your body during rapid physical changes. This price list outlines the flat-rate fees for Canadian patients. A gastric sleeve is approximately $10,000 Canadian dollars, while a gastric bypass is roughly $11,600. These figures cover the complete medical package, including the operating room, hospital stay, surgical team, anesthesia, consultations, and post-operative medications. To budget accurately, patients must account for exclusions. You are responsible for flights, local hotel accommodations, your travel insurance, and initial lab tests. Removing financial ambiguity from the medical package allows you to focus entirely on healing, without worrying about hidden hospital fees. No patient boards a flight home without clearance. Dr. Meza conducts a final in-person clinical evaluation to verify that pain is controlled, liquids are tolerated, and there are 0 signs of infection or leakage. Only then is a formal letter of aptitude to fly signed. Flying after abdominal surgery carries a distinct risk of deep vein thrombosis or blood clots. To counter this, the clinic prescribes specific preventative measures, including a dose of low molecular weight heparin, a blood thinner, and requires the use of compression socks for the journey. Patients must book an aisle seat, maintain strict hydration, and physically get up to move around the cabin every hour to keep their circulation active. The clinical responsibility extends past the hospital doors, remaining active until the patient has safely touched down and stabilized in their home country. Recovery shifts to a structured virtual follow-up schedule. The team monitors your progress at 6 weeks and again at 3, 6, and 12 months, ensuring your nutritional intake and metabolic changes are on track. This postoperative data is designed to be shared. The clinic coordinates directly with your primary care physician in Canada, so your local doctor has total visibility into your ongoing care. This patient questionnaire is the first required step. It captures your complete medical history, previous surgeries, and current medications, forming the baseline for your clinical evaluation. By submitting this data, passing the domestic medical exams, and adhering to the preoperative timeline, you create a heavily engineered foundation for your surgery and a secure starting point for your recovery.